Hi, I'm Laura Ferris. Today I talked about what's new and hot in melanoma. So I started out talking about some new ways to improve our diagnostic accuracy. So I talked about a study that showed that a device that uses electroimpedance spectroscopy can actually improve our biopsy ratios and accuracy over clinical exam and even dermoscopy alone. I then talked about the treatment in advanced melanoma. So I talked about some of the new therapies. There's tons of changes. I talked about a drug called relatlimab, which is an anti-LAG3 antibody that's being used to treat advanced melanoma. And then I talked about using immunotherapy earlier in the treatment of disease. So I talked about the use of adjuvant pembrolizumab for stage 2B and 2C melanoma. This is a newly FDA-approved indication. And then I talked about the use of neoadjuvant therapy, which is using immunotherapy before surgery to try to get an even better immune response, and really how that might transform how we treat our patients with melanoma. And then finally, I also touched on, we have so many good drugs. We have targeted therapies for BRAF mutated melanoma. We also have immunotherapy. Where do we start? And I talked about the DREAMseq trial, which gave us good insight to show that starting with upfront immunotherapy for BRAF mutated melanomas really has better outcomes for patients.